Dental implants are artificial tooth roots used to replace missing teeth. They are typically made of biocompatible materials, most commonly titanium, which allows them to integrate with the jawbone and provide a strong foundation for dental restorations such as crowns, bridges, or dentures. Initial consultation. The first step is to consult with a qualified dentist or oral surgeon. They will examine your oral health, take x-rays, and discuss your dental history to determine if you are a suitable candidate for dental implants. Treatment planning. Based on the examination results, the dental professional will develop a personalized treatment plan tailored to your specific needs. This plan will outline the number of implants required and the placement strategy. Anesthesia. Before the surgery begins, the dentist or oral surgeon will administer local anesthesia to numb the area where the implant will be placed. Incision and implant placement. Once the anesthesia has taken effect, the dental professional will make an incision in the gum tissue to expose the jawbone. They will then use specialized drills to create a small hole or socket in the bone for each implant. The dental implant, which is a titanium screw-like structure, is carefully placed into the prepared socket. Stitching. After the implant is in place, the gum tissue is stitched back together. In some cases, a healing cap or cover screw may be placed on top of the implant to protect it during the healing process. After the stitching is done, the doctor will now recheck your teeth again using a dental x-ray. Post-operative care. After the surgery is complete, the dental team will provide you with post-operative instructions to follow at home. This may include guidelines on how to manage pain, swelling, and any potential bleeding. Once everything is checked and everything was okay, you may now be allowed to go home. Advantages of dental implants include improved appearance. They look and feel like natural teeth. Enhanced function. Dental implants restore the ability to chew and speak comfortably. Durability. With proper care, dental implants can last for many years or even a lifetime. Bone preservation. Implants help prevent bone loss in the jaw, which often occurs after tooth loss. No impact on neighboring teeth. Unlike traditional dental bridges, implants do not rely on adjacent teeth for support. If you're in need of dental services, don't hesitate to visit us at Oaks Dental Clinic, where your smile is our priority.